USMLE style question, Lissencephaly. A 3-month-old infant is brought to the pediatrician due to seizures and developmental delay. The mother reports that the baby has poor feeding, weak muscle tone, and does not track objects well. Physical examination reveals microcephaly, hypotonia, and poor head control. MRI of the brain shows a smooth cerebral surface with a lack of normal gyri and sulci. Genetic testing reveals an OT mutation in the LIS1 gene. Which of the following best describes the underlying pathophysiology of this condition? A. Defective neuronal migration during cortical development. B. Failure of closure of the anterior neuropore. C. Destruction of neurons due to intrauterine ischemic insult. D. Abnormal accumulation of cerebrospinal fluid within the ventricles. E. Disruption of neural crest cell migration. Answer A. Defective neuronal migration during cortical development. Explanation: Lissencephaly, smooth brain, is a neuronal migration disorder where neurons fail to properly migrate to the cerebral cortex during fetal development. This results in a smooth brain surface without normal gyri and sulci, leading to severe intellectual disability, epilepsy, and developmental delay. Genetic causes include mutations in LIS1 gene, PAF1B1, classic lissencephaly, DCX gene, double cortin, X-linked lissencephaly in males, TUBA1A gene, tubulin-associated lissencephaly. Clinical presentation: severe hypotonia, feeding difficulties, intellectual disability, seizures, infantile spasms. Microcephaly: why other choices are incorrect. B. Failure of closure of the anterior neuropore describes anencephaly, which leads to absence of the brain and skull, not lissencephaly. C. Destruction of neurons due to intrauterine ischemic insult describes porencephaly or hydranencephaly, not lissencephaly. Abnormal accumulation of cerebrospinal fluid within the ventricles refers to hydrocephalus, which can cause macrocephaly, not the smooth brain seen in lissencephaly. Disruption of neural crest cell migration. Neural crest cells contribute to craniofacial structures and peripheral nervous system, but not to cortical development. Clinical relevance: MRI findings, smooth brain surface, thickened cortex, and paucity of sulci. Prognosis: severe developmental delay, refractory epilepsy, and early mortality. No cure, but treatment focuses on seizure control and supportive care. Would you like